to scientific committee and Namrata ma'am for providing YOSI with this opportunity. And we are very grateful actually to Dr. Jignesh Taswal sir, who has agreed to be a keynote speaker in this session. There has been slight dropouts because of multiple parallel commitments that are going on right now, last day. So most of them have to catch flight and they are like running between the halls. They will be coming and joining us soon. So I think it will be better if we start with the keynote address first. Yeah, sir, please take it. Yeah. Please upload the slide of Jignesh sir. The pearls for setting up practice for a fresh graduate, I think.
Yeah.
That is a very important topic.
Absolutely. At the outset, I would like to thank Dr. Namrata Sharma and her team for allowing me to speak and give a keynote address to this YOSI group. Friends, everybody goes to the teething stage. So I have my 10 pearls. For those who have started practice, I have tried to target one age group. I'll just be disclosing that. What you need is proper financial planning and budgeting of the session, searching for an appropriate place, then which instrument are you going to invest in. You see the ophthalmic instruments range from a lakh to a crore. So you really need to budget it out. Then staff recruitment, your presence on social platforms, institutional association and attachment, observership at seniors and teachers center, your association with the neutral diagnostic centers, the neutral OTs, on-rent instruments, on-rent machines, and on-rent OT. Honing of skills for newer treatment modalities, upgradation and upscaling of infrastructure and instrumentation. On this 10 pearls, one by one, I'll try and cover it, and you'll see to it that you can set up your practice comfortably without stress. Even I have gone through all this, so this is nothing mentioned in any of the books. So the target audience I've taken is 28 to 35. Everybody completes their post-graduation by 27 to 30, depending upon their age. For 28 to 35, first you have to decide your priorities and your goals. Whether you'd like to do super specialist training or you would like to start fresh right away. Setting up your professional practice, you either have a small office or you have a full hospital premises, depending upon the funds. Equipments also, the basic and the advanced. Residential property, insurance, you have Mediclaim, it's very important nowadays. Term insurance, FBAS, AIOS, we have it with the All India Ophthalmological Society. It is a family benefit scheme. Professional indemnity. Then savings, shares, FDs, mutual funds, gold and real estate. We'll touch up to each of this individually. Vehicles, what you'd like to have, a two-wheeler, four-wheeler to start with, and of course, marriage. In financial planning, you need to work out the approximate cost of the infrastructure. भाई पैसा है तो सब कुछ है. हर एक चीज़ पैसे से काम करती है. As a general ophthalmologist and as a super specialist or a subspecialist, you have three options here. If you have good enough amount of money, you have a family backup, then you buy the place right away and buy on self or on loan and install the equipment. If you have no money, for the infrastructure, you rent out a clinic. You have a rental clinic and buy the basic equipment and take advanced instrument depending upon your subspecialties. And if you have no money at all, then you go in only for a rental clinic and rental instruments. Budgeting. How much allocation are you going to put for each of this? Now, day-to-day expenses you have the EMIs to pay because you don't have cash in hand. So you have to repay the loans. The staff that you have to pay them. Margin money for buying new equipment. Any equipment you buy, any bank gives about 15 to 20% of your margin money that you have to put in, and 80 to 85% is what the banks chip in. Then for the Mediclaim, life insurance, professional indemnity, you have to make arrangements for that. Your daily utility expenses, telephone, cell phone charges, MSCB, property tax, professional tax, biomedical waste. If you plan to buy a house, then the housing loan comes up. Then you have personal expenses, paying income tax. I would recommend everybody to start paying income tax on day one because that is your white that you're going to build up and which is going to help you later on whenever you are planning to buy advanced equipment which is in crores. So if you have a good wide build up, you have very good chance of getting loans from the banks easily. And then do file, that's what I've written. And you build up your void as required for the margin money. Then saving FDs, mutual funds, shares, gold, and real estate. Setting up of the infrastructure. If you have funds, you buy it straight off. Otherwise, you go in for rental. If you are doing ownership, again, you have bank loans, and if you have financial backing from your parents and relatives. You have to pick up a proper real estate agent who has a good reputation for both rental and for the ownership. Loans are available by the nationalized bank, the semi-nationalized bank, and the private banks. Nationalized bank give you cheaper interest rates. It's almost 1 to 1.5 less than what you are available with the semi and the private banks. The processing fees are also very cheap, but they are very, very poor in services. You have to wait in the lines, your work is not done, you have to physically visit. Of course, days have changed now. The private banks give good services, but the interest rate is almost 1.5 to 2 more than the regular interest rates. We have two types of loans that you have, a floating interest and the fixed interest. In the floating interest, what you have is it keeps fluctuating year to year, month to month. So if the interests are very high, then it is always better to take a floating interest loan, because then it is going to come down and you're going to get less and less interest to be charged over your EMI. But if you have fixed interest rates, whatever you have, suppose the interest rate goes to 6% or it is on 12%, whatever you have bought at that pre-interest rate, you have to pay. So be very choosy at the first itself. Later on, they don't allow you to change. Equated monthly installment. What is an equated monthly installment? It takes the capital into account and the interest that is paid. Banks are there to earn. So they are going to collect their interest first. So the interest component is higher initially and the capital component is very less. So for an initial person who has started the practice, who doesn't want stress, you have to take on a staggering basis the loans that you are going to take over a period of time, and take it for a maximum period. So you have lesser amount of EMI to be paid. For any loan availment, you have to have proper budgeting, and a project report has to be prepared. If the bank lends you money, you need to submit a blueprint of your earnings and how you are going to grow over the next 5 years after taking care of the expenses. As I just told you, the margin money is between 15 to 20%, 25%, depending upon which bank you approach. You have what you have to generate and pay at the time of the loan disbursement. No bank gives 100% loan unless it is a personal loan. But then if it is a personal and unsecured, the rate of interest is very, very heavy. The margin money comes from your savings, from your help from the parents, relatives, and friends. Always and always go for a nationalized bank. As you said, the interest is lower. Because even say you buy this thing of 10 lakhs and the interest is around 10%. So you're paying 1,000 per lakh. So you're paying 10,000. That is the amount of interest you're going to pay. And that you spread out over the period of 1 year, divided into 12 is the amount of interest that you're paying per month. So it does count. Even a 2% and 3% on a 50 lakh loan works out to be in thousands. So in initial day of practice, it's very difficult to avail all this. So be very choosy, go to a nationalized bank and go in for it. So that is the lowest written. What is moratorium? Moratorium is a period where you are not paying the EMI at all. Some banks give for 3 months, some give for 6 months. Because the moment you buy an equipment or an infrastructure premises, you don't earn the very next day. So they give you that interest-free, capital-free area, the EMI free over a period of 3 to 6 months. You ask them, the more is better for you, and after that the EMI starts. That is how it is. So again, go for the moratorium and staggering payment. Staggering payment is initially you have, say you have taken a loan of 10 lakhs, your EMI comes out to be 50,000. So you tell them initially, let the EMI be 25 over a period of 2 years, then you make it 30, 35, 40, 50, 55. As your practice grows, it is easy for you to pay and there is less stress on the mind. The project rate that you prepare, the blueprint that you are going to submit, it's not going further, boss. आगे नहीं जा रहा है. Okay. Arranging the finances. Never take a credit card loan. I don't know how many people use the credit card. The interest rates vary from 24 to 36%, 21 to 36 payment. And even if you're 1 day late, the full interest is charged. Suppose you're taking a 50,000 loan into 36, so that is about 18,000. So 1800. So 1800 is charged. Say on 7th is your due date. On the 8th, they'll charge you straight away. Forget about the rest. And that starts building up. So don't try and skip any EMI as the interest starts building up. Initially, interest component is more, as I just said, the bank wants to earn from you, and the capital component is less. Always take loan on a daily or a monthly reducing balance. It is available as annual, it is available as monthly, and on a daily basis. So daily basis works the least. I mean, it taxes the pocket the least. Ask the bank which type of year they're giving. Always go for the nationalized banks. I have given the list of the nationalized banks which give you loan easily. Why it is important? Searching a place. You need to decide first whether going for the ownership or rental. Ideally choose as per your budget. Points to be kept in mind, it should be easily approachable by all modes of transport. Very easily accessible, it should be either ground floor or first floor, as we have most of them are the geriatric patients which are walking in. 3, it's in the close vicinity about the ICU. If you have any emergency, you should be able to shift in a very quick time. Of course, enough parking place, paid or otherwise. Now that you're going to pay EMI, you know how to do the generation of income. So your income on OPD, diagnostics, your procedures, operations is one way. Then you have professional income from your institute which you have joined, which you attached the same sources. Then you can have an optical shop and you start earning on that. Contact lenses and low visual aids. Optical shop, I'll tell you, it's very good as an earning source. अपने को 600 रुपये देने के लिए या 1000 रुपये देने को तकलीफ देती है. There they spend about 5,000 and 10,000 easily. So if you have an optical shop outlet, it is a very good source of income. Generating more surgeries at a discounted rate by conducting free diagnostic camps at your center once in a month. That also not on your OPD days, but on a Sunday, a non-working day. Visiting peripheral rural areas by conducting outreach eye checkup camps in rural area once a week, fortnight, month, thereby having a surgical inflow from such camps to your main center. Please let me know when to stop. No issues. Conducting paid subspecialty training, wet labs, tutorial classes for PGs. That is another way of having income. You have your articles in newsprint, lectures in NGO, radio, TV, public awareness programs for the better outreach to the general public and becoming a face in the crowd. Equipment, again, as I just said, 2 options, basic equipment by loans, and rest you can have group practice. In our centers in Maharashtra, in Sangli, they have a very good center which has come up where they have group practice and they're doing very well. So join a group practice by contributing and then sharing returns proportionately. Suppose 10 lakh, 1 crore ka hai and you put 10 lakhs. So 10% is the proportion that you are going to gain out of it. Buy basic and take advance on rent. But this option is not available all over because rental instruments, see, we have YAG laser available, we have perimetry available, we have OCTs available on rent. But maybe in other centers it's not available, so you have the options. Keep it in mind. When you buy an equipment, the conferences are the best place to have this. Then you have a group of people who can buy the same common equipment. You have the bargaining and a trading power to get the equipment of your choice at grossly discounted rates. In case you are an individual, you would ask the seniors, "Bhaiya instrument ka kya hai? What is the testimonials about it?" And then you should buy. Bundling offers are, of course, there for the major instruments when you have tie-up, but you be very, very cautious on the overall deal that you have with these companies because they try and cover up and see that the whole equipment is what you're paying for. Which equipment to invest initially? In the rural areas and the tier 2, tier 3 cities, but what you have is the OPD chair unit, slit lamp, autoref, keratometer, direct, indirect, tonometer. Rest of the instruments you buy as per your subspecialty. If you're a glaucoma consultant, you should have a perimetry at least, minimum autoperimetry to be there. OCTs if you are a retinal surgeon. And of course, accordingly to your subspecialties, you should buy. For the basic equipment, an OT table, motorized with a surgeon chair, a phaco surgical instruments with SICS, Said the Indian ones are very good at a highly discounted rates as compared to the imported ones. Rest of the equipment again as per your specialty. OPD and OT equipment and instruments usually to be bought in a conference, as I just said, you have very good quality and it doesn't compromise on the quality. Staff recruitment is very important. As a solo practitioner, start with a bare minimum. Your front desk, you have a receptionist which takes care of the patient's outflow. You take mock training sessions and train them the basic etiquettes and how to deal, because that is the face of your clinic. Handle patients with various temperaments in a good way. They being the face, they should be able to handle it very nicely. OT assistants, you can have a dedicated OT assistant, or you train the reception part into it because you have just started, so you don't want to shell out more money in this. So you can have it that way also. If you have an inbuilt OT, then you have a maid and IR to take care of the cleanliness. Tip is you have to have a trained OT assistant specifically mentioned for the ophthalmic purpose, because there are OT assistants but they are for the general purposes. So train them for that, so they be very, very useful. Unskilled, according to, you can pick up the unskilled also because they require less salary. Mainly, I am talking about the rural and the semi-rural areas where multitasking is there by a single assistant. Your presence on social platforms. Well, in today's world, if you are not on the social platform, you are not in the race. You should be on the Facebook, Twitter, Instagram, and WhatsApp. Have your own website. It's a big, big boon. Blogging is equally important. All this help you have a virtual presence then. Post your things, the latest events, your happenings of the center, updating of the skills, receiving due recognition, appreciation, awards by renowned societies and world over. Showcase your professional and personal talents on all platforms. Please don't post videos showing face of the patient without the explicit consent of the patient. Best to avoid. Another source of income is your institutional attachment, which gives you wider reach. You reach, now I have been attached to about 3 institutes. The number of patients increase exponentially. Also, interaction with the fellow consultants, you have cross referrals there, and that also grows your earnings. Emergencies, house calls, in casualty. Keep your surgical hand at work, especially initial phase of solo practice where cases are very few. Joining a charitable institute is another way where you hone your skills and have a wider acceptance. You need to fine tune and balance your central work with the institute. Ultimately, it's your own center which is going to give you this. So devote more times to your center. Observership at your teachers and senior center. Best is to do a proper fellowship. If you have planned out either in retina or refractive, whatever you feel you are best in. As a general ophthalmologist in an initial phase, for more confidence in this, please keep attending webinars, regular wet labs, observe surgeries as the teachers and colleagues whom rate in high esteem. Physically attending gives you a better advantage because you see the OT setup, how he functions is, the small hand movements that are seen, how he uses the foot pedal, very small little things, but it'll go a great way. These are good pearls that you pick up from the ophthalmic surgeon, a reputed one. Yes, for the surgical steps, numerous videos are available on the YouTube. Of course, intricate here, you can keep rewinding and see and master each and every step. You tie up with the neutral diagnostic and OTs, as I said, to save costs without compromising on the quality of surgery. For beginners, I recommend to have a tie-up with all well-equipped centers who allow you to do diagnostic tests, your procedures, your operation as a predetermined rate. You work out the logistics with the center, ask for this so you know what are your expenses in that neutral center. So you save on huge investments. You require less investment in space and equipment. Also, you can join like-minded colleagues to have a neutral center, put your own contribution, and have the best of the equipments, infrastructure, OT, and support staff, all at a fraction of a cost which would you have invested otherwise. Honing of your skills for newer techniques and modalities. Majority of the surgical vendors are ready to allow you to use their newer machines. Of course, Alcon has also already started fellowship where you can do your hands-on training. Short observership is also very good. Hands-on teaching with newer techniques and surgeries are also available. Of course, our very own YouTube also has all the new techniques where you can pick up, see and clear doubts, and also on WhatsApp. Upgradation, upscaling of your infrastructure. For growth and being at par with the best in your area, you have to decide a timeline to add on the advanced equipment from time to time in a staggered manner. For having all the new machinery, you need extra space. So expansion of your center, either in the add-on or a separate entity in the adjoining premises for convenience of functioning has to be done as and when the fund and space is available. Proper training and know-how of the operating newer machinery has also to be kept in mind before installation, usually done by the vendors themselves. Now, residential property. You have to decide if you have funds initially, you can start buying it. But this thing is always try and see that your professional practice develops very nicely. You have enough money to buy a house. Of course, go in for an EMI because the home loans are very, very cheaper. What you get, professional equipment is 13.5%. Home loans are available at 9 and 9.5%. So almost 4% less. Usually no separate security required as home itself is the mortgaged by the bank. So the lower interest is applicable. Loans disbursed are almost 85% of the total value, 15% is your contribution, and it is 20 times your net income is what you get. And the payment period is also almost 10 to 20 years. It's not 4 or 5 years that you get for the medical equipment and this. Insurance, you should have Mediclaim, friends. I see younger generation at 30, 35 having heart attacks and all. So you have a good cover. The base insurance, the base installments are very less. Now, as of today, I am 66. So I am paying insurance of, say, about on 10 lakhs, about 50,000. For the same of 10 lakhs, you pay only 2 or 3,000 initially. So start having Mediclaim insurance from day one. Family floater is you and your whole family. Say, I'm taking 20 lakh loan and I'm getting a 20 lakh insurance. I am paying an EMI of only about, say, 40,000. So that covers all the five family members, whoever are there. Anyone can claim in that or till you exhaust that amount, whatever you have asked for. And individual. Professional indemnity is the in thing nowadays. You should be fully backed up because there are lawyers who can take care of your this thing. Term insurance, of course, security for your near and dear ones, you should have. Investments. Now you say, Baba, abhi to naya naya practice shuru kiya, invest kyun karu main? No. You should save at least 20% of your income as savings. Either in FDs, either in the saving banks. Saving bank, of course, it doesn't beat the inflation. Suppose if it is 7%, you get 3.5%, so you're losing money. So there is no point keeping in the saving bank account. Put it in fixed deposit. Best are the corporates. It's very safe, and the interest rate is much better than the nationalized banks. Shares, equities, and futures. Of course, the way you do ophthalmology, you have to study shares. They give you fantastic returns, almost 120 in the last boom run. People have earned almost 100. 1 lakh ka 2 lakh ho gaya ek saal mein. Where you have, if you keep it in bank, it takes 10 years. So that is the type of returns you have in shares. But initial stage, you have to have a proper allocation of your funds. Say if you have 1 lakh of fund, so only 10 to 20% of that should go into shares, not more than that. In case you plan to have a second option, earning option in a much better way like you have in private practice. And mutual funds, that is a steady income that you have in mutual funds. There are debt funds, there are equity funds, there are hybrid funds and all. So you work it out, take a financial consultant initially, they'll help you out how to work it out. Last 2 minutes. Now, having a vehicle, of course, is very important. Without a vehicle, so in the rural and taluka places, two-wheelers suffice. If you're close to the house and this, you should have it. Buy a new one if the loans are given for that. But keep it as a second option. And marriage, of course, I would say keep it after 5 years of it when you have reasonable income for your household expenses, personal, professional EMI, and day-to-day expenses. Saving around 20% of your annual income. So thank you very much for patient learning. Sorry to overshoot, but I wanted to explain because
Yes, sir. It's a very important.
Small little tips over my 30 years, 40 years of my practice. I've tried to put it into one presentation. Thank you very much.
Thank you, sir. We would like to invite you to have a chair on dice so that we can have a discussion. And I would like to invite everyone, those who are young and are starting with practice, please come forward so that we can hear you and we can have a lively discussion because we have very less number of speakers. More discussion will be happening.
So, first of all, I'll start off like, how many of you are in your private practices? Can you raise your hands? Private practices, okay. So, let's go to people who are less than 5 years in their practice. How many so far? Okay. So, we are all in, some of us, it's about 30% of the people. So, so do you have a rental-based property? These are all the points that sir just said. I'm just having a poll right now. So, do you have a rental-based property? Rental-based property, okay. And how many have got their own properties? Okay. So initially set up, what sir was saying is it makes much more sense if you go for a rental based property if you don't have the funds. But yes, later on when you expand to more branches or something, you will need your own property to set up an institute or a big setup. Uh, how many of you work on Sundays? Okay. So the new generation, what about you? No. So we
Even Saturday is half day for me.
so no, Saturday is the most busy day. So a work-life balance, I feel, is very important. And I think our generation has now taken a step that, we're not going to work on Sunday. We'll work less, but we'll spend the time with the family. And I think that's very, very important. Or it doesn't have to be a Sunday. You need a day off in the middle to recharge your batteries. So, any points?
So I just wanted to ask you, in the first slide where you started, you told 28 to 35 years of age, they need to explore things. I think we should encourage them to start early when they join the post-graduation, because I've seen many of my young colleagues who, after passing out, they are clueless. They want to do corporate, they want to do private practice, they want to join a teaching institution. And it becomes like 30 to 33 years of age till the time they figure out where they want to go. And most of the prime time goes off.
Absolutely, Nilesh, you're quite right. Why I suggested that is, in case when you're doing a post-graduation and you start your practice, you're doubly stressed. You're doing a post-graduation to pass out, and plus you want to earn also. It's a good thing, but if you can take the stress, good enough. You can start.
Apart from that, like what I told about taking the Saturdays is a half day for me. It depends on what you want to do. So like I have to do research activities that I can't live without. And then I have YOSI where we all have time to devote. So during the busy practice, we can't take out time. So I have consciously decided that Saturday afternoon and evening is dedicated to my research and my YOSI activities. So similarly, if you are into those added things,
Absolutely.
so you need to have time. You can't take Sundays off and then work on Sunday and you are sitting on computer and writing research articles. So that doesn't make it time off.
Absolutely.
one important point that
Yeah.
sir raised is that you don't need to buy everything in your initial practices. You need the basic cataract setup and your specialty setup, but you don't need to go for the hi-fi machines. You can do your torics, you can do your multifocals with an AR and a ultrasound biometry as well, obviously immersion. But in coming to the tonometer, I have a choice. So you should definitely have an application tonometer with you. And there's a debate. How many of you have an NCT? How many of you? I don't. So how many of you have a rebound tonometer? So a rebound tonometer, I feel, is a very good device for persons who've got a lesser practice. First of all, it's going to be lesser, it's about half the price, I guess. Second of all, it's more accurate. NCT is actually a screening device. Please remember that. A rebound tonometer will give you almost as accurate results as an application tonometer. In corneal diseases, I'm a cornea surgeon. So in corneal diseases, a rebound tonometer is one of the most accurate devices. So it depends also on your load. In the initial practices, if you've got 20, 30, 50 patients, that works for you. But if you've got 100 patients, yes, you need your screening for that.
I think in 20-30 patient applanation, they can do applanation in all the patients.
Applanation is not possible. It's a
at the
touch
end.
technique.
Yeah, no, but it can be done. Like if it is like 20-30 patients only, then probably even investing 2 lakh rupees for a rebound tonometer doesn't, when you can get a applanation for 40-50,000. And that is a gold standard. So you were making some points.
Yeah, nee, I just wanted to ask whether they have any questions we would like to ask, because we are just 5 minutes of the session now. The next
No,
session.
sir. We got the session 40 minutes late. We
I
got the
know,
hall,
but-
so we have a lot of time.
Okay.
Yeah.
We have another 40 minutes to go.
Okay.
45 minutes.
Dr.
50 minutes
Kushagri,
to
you
go.
can take the stage and prepare for your talk. Meanwhile,
Since we got the session
any
late,
any
so-
question, anything in your mind, because these things are not taught in any college, and most of the college the faculty is into teaching institutions, so they don't have much exposure to this. So please feel free.
Yes, please feel free, because what I have put is nothing written in the books. If you have seen, as I have developed my practice, I have just started to put it. So it will be definitely helpful for each one of you if you have go through it very closely. So any questions you should speak. Anyway, I
if
think
you
he's
want,
ready
we
with
can
it.
cut short the talks. We can do more discussion. That's not a problem. If you guys have questions, we'll shorten the talks. Our speakers will understand.
Dr. Kushagra Jain from
So
Indore, he
so
is.
he is he just finished his fellowship, and he opened a big hospital with a bang. Okay, with bang, having everything in Indore. He got two of his friends to join him, who are different specialities. He does retina, one does cornea, and one does glaucoma. And they're expanding. They from day one, I think you got a LASIK, you got topography, you got everything it is. So he is going to, he's the right way when you're finding your niche. He's trying to build a corporate practice. He already has other hospitals, but so he's going to speak about finding your niche in a corporate-driven world. Over to you, Kushagra.
Good morning, everybody. So, first of all, sir has actually given a very exhaustive talk. So, everything is actually very well covered. I'm just going to give my two bits on this from a young ophthalmologist's perspective. So, the topic is finding your niche in a corporate driven world. I'm Dr. Kushagra Jain. I'm director and vitreoretinal surgeon at SRJ Netralaya in Indore. So there can be two ways to go about this. One is finding your niche as an ophthalmologist, as a vitreoretinal surgeon in that corporate world in the city that you live in. And the second is as a setup, how you develop a niche for your setup amongst the different corporate setups, right? So I'm going to go with the latter and talk more about the setup and how you deal with the other corporates and how you go about the practice. So just a bit of background of me so that I can take the talk forward from there. I am from Indore, which is a tier 2 city. So tier 2 cities have their own advantages and disadvantages. The advantages, when I joined my fellowship, I was already in the process of thinking what I want to do, how I want to go about my practice, whether I want to join more corporates or start off my own hospital. So the good thing about tier 2 cities at that time was that there were no major corporates, right? There was maybe one or two. In my case, only one, and more or less they were more of private setups, and all of them, there were very few setups which are very comprehensive. So the private setups were also either more focusing on anterior segments, or there were a few who were focusing on the posterior segments, but there was no comprehensive setup other than one or two hospitals. So that is one good advantage that I had with Indore, and that was my goal. That is what exactly I wanted to do. And so I'm a first generation ophthalmologist, so I did not have any practice to build up that upon, so I had to start from scratch. So that can be tough to do in being a first generation ophthalmologist, and at the same time it was a good business opportunity, but because there was no major centers like that. But now when then I finished my fellowship and I came back to Indore, there was like this sudden flood of corporates, which is true for all tier 2 cities, right? Everything just all of them just open up together, the usual suspects. So what do you do then? You analyze and you reanalyze and you think what are the challenges that you can face because of these corporates. Not to say anything against the corporates, but these are the usual challenges that private practitioners face when they compete with these corporates. So the first thing is the brand, right? all of all the general public knows about these brands. There's a lot of marketing happening, so a brand does attract patients from the very first go, from the first day. So that is the biggest challenge that private practitioners face from the corporates. The second is, we know all the deep pockets and all the enormous marketing budget that they have. So the corporates have, a lot of them have full page newspaper ads monthly, which cost nowhere less than 3 to 5 lakhs per month, which initial private practitioners can't even think of spending in their initial years of practice. Then there are hoardings all over the place, all over the city, which you really can't do, again, which cost about 2 to 4 lakhs, 5 lakhs per month easily. A lot of them give free OPDs. That is something that we can do, but that is one more challenge. The other thing is high paying capacity to professionals. So when you're trying to build up your own private practice and you are the sole practitioner, then it's okay. But if you want to hire other professionals, other subspecialty surgeons, then you have to compete with these professionals to pay them similarly. And one more very specific thing that I now face with the corporates is that the medical claim approvals and the rate lists that we get from the medical claim companies are very different from these corporates. So all the rate list approvals that they get are very centralized, and we at private practitioners deal with the local bodies, and the rate lists are nowhere comparable. So that is one thing that I don't think there's a solution to this, but this is one of the challenges that I face now. So when you start off, like when I started off, at least, I really feel that competition doesn't matter. It doesn't matter what corporates are there, how many practitioners are there in your city, how many corporates are there, how many retinal surgeons, or for me, are there in the city, because you are nowhere. You are like at the bottom of the food chain. So competition doesn't matter. You have to actually make yourself worthy of competition first. You have to reach a certain level, and then you can maybe try to compete with the others, right? So first thing, get your bases covered, make a place for yourself. The first thing is to, so I've jotted down to 4 major points. If you have these 4 working on the first day for you, then you are on the right track, right? So first thing, what is your vision, goal, aim, whatever you want to call it? Know your niche before you start to find it. So you need to decide what kind of a practice you want to build. You want to open a clinic, or you want to, as sir said, you want to join and partner with other neutral diagnostic centers and neutral surgical centers, or you want to develop a comprehensive setup with other surgeons, maybe in partnership, maybe you want to hire them, maybe you want to develop an institute, maybe you want to, if you want, you can, start off with different branches, go into a chain model, you can get funding. There are so many ways to go about it. You need to actually make up your mind what you exactly want to do, and that is actually the most important thing. A lot of people start off their practice, they're very confused which way they want to go. I feel this is very, sorry, I don't think my 8 minutes are over, but okay. So, yeah. So this is, I think, one thing which is very unclear with a lot of people, and this is, I think, the most important thing where people need clarity of what they want to do, because uh, things can go in very, very different directions. You need to be very goal oriented and very focused. The second thing is you need to build up a team. So in my what I did was I made a comprehensive setup. That was always the best thing that I wanted to do. So I obviously wanted the best surgical expertise. Without a surgical expertise, without good surgeons, you can't do anything. So I wanted to cover. I practice posterior segment. I had good. I was very, very lucky, and I have actually YOSI to contribute for that. So I actually, that time they had opened a hiring portal on which I had posted a vacancy for my hospital for all the subspecialties, and through there I had Dr. Nikunj and Dr. Shivani, who responded to that portal of YOSI and then contacted me. Of course, they were colleagues of mine previously, but that is how they came into touch with me through the YOSI portal. So thank you for that. The third thing is the equipment. As sir said, good equipment is very, very important for delivering good results. So if my take on this is that if you don't have a source of capital, then yes, go with cheaper equipments. There are a lot of good options, and eventually when you develop your practice and you develop some capital in the next 3 to 5 years, you are going to possibly upgrade. That is the goal for everybody. But I feel if you do have a source of capital, then do invest in all the better equipments, because if you invest them, you are going to get better results. The equipments for better equipments for young surgeons are far, far more, helpful for a young surgeon than they are for an older surgeon who is more experienced, because they do help you in your practice and delivering your results. And then, if you have your good equipments from day one, you can actually plan them to keep them for the next 10, 15 years even, and you don't have to invest in them later. So that is my take. If you have the source of capital, go ahead and take that risk, because you have to take that risk on yourself. If you don't have the capital, you have a lot of options. The fourth thing is to make protocols. There are protocols for everything. There are protocols for documentation, for registration, for patient flow management. There are protocols for the consent forms, right? There are protocols for your IPD filing, your NABH protocols. These protocols help you to maintain your quality. So one day I just went to see an emergency patient on a Sunday, and we are very lazy on a Sunday. You don't want to switch on your computer, you don't know how to switch on the AMR, you don't know how to register your patient. So I just brought out a prescription, tried scribbling on it, which I never do. I use an EMR. So on that day, that was an acute angle closure attack patient. I forgot to mention the IOP of that patient, right? I mentioned all the treatment and everything, but I forgot to mention the IOP. So these are the sort of basic mistakes that you do when you don't follow your protocols. It's very important to follow protocols to save you from yourself. So these are just 7, 8 points apart from these 4 major things. So staff is very, very, very important. So when you are young, for me, like I was an amateur, I started off just immediately after my fellowship, I opened a hospital. If when you are not experienced, you can actually hire experienced staff. Like you can bring experience from outside to help you. And there are very, very minor things that my staff had, you know, taught me, and they came from all different corporates and they've been working in this field for the last 10 years. And sometimes you feel कि यार मैं boss हूँ कि वो क्या मुझे सिखा रहे हैं, but you know, you are the amateur, you don't know how things work in an ophthalmological hospital. You have to be humble enough to, you know, learn from them. You have to be humble enough to accept that they are more experienced, and you have to take that in. The second thing is, of course, when you're beginning, you have to multitask your stuff and you have to multitask yourself. But at the same time, I feel we should not be too stingy about this. Another one extra hand, 2 extra hands really go on a long way to make those small changes in your hospital, do those small jobs which just, you know, increase the quality of your work. Welcoming faces change the vibe. I really feel this is one thing that I really feel that, you know, we can, as private practitioners, offer more than corporate hospitals, because this how the staff behaves, how welcoming the staff is, how you are welcoming, how much you're counseling the patients, how well you're talking to the patients, how the first contact, I feel the registration person who's registering your patient, how that patient is greeting the patient, that is the most important thing. And that is something that you can really implement in a private practice more better way than a corporate hospitals. I really feel that. Time is in your hand when you're starting your practice, right? So when you're starting your practice, you have less patients, you have more time. So time is one thing that is cheap, that is freely available when you're starting off, and that is really an advantage over the other corporate hospitals. Reduce your waiting time, and give more chair time. These are the only 2 most important things that I feel a patient wants from any hospital. And see, when a patient is coming to you as as a young professional, he's not he's okay with you not being experienced. But if you save his time, if you take less time to see him, if you give him more chair time, if you listen to him, if you know understand his problem, that is something that you can give more, and he can value that more than, you know, going to a more experienced surgeon. So for a young professional, giving more time to your patients and reducing his overall OPD time can be very, very important, can be a big bonus, which is very cheap for you to do over the other corporates and more experienced surgeons, right? Again, जो दिखता है वो बिकता है, as sir said, you have to, as young professionals, when you're competing with all the corporates, you have to bring out, you have to flaunt your degrees, your designations, your awards, your fellowships, your everything, your research papers, and whatever marketing you can do, right? So
To the next. Yeah, sir. We got the hall 40 minutes late. We got around 11 o'clock. So 11:10 actually we got the hall. So we'll try to wind up by 12:15. But thank you.
right, so getting back to it, spend on your board and your EMR. I feel this is very, very important. You need to be very, very visible when you're competing with these corporates. So spend on your branding and your board. It should be absolutely visible in bold, big letters. Spend on your name. Your name should be visible. The hospital's name should be visible. Spend on an EMR, again, that manages your quality. Uh, yeah, charges. Start with low charges. You know, initially, don't sell yourself too high. Don't overestimate yourself. This is very, very important. You are actually at the bottom of the food chain, so you have to accept the fact. You have to start with low charges. This is very, very important for hospitals to be able to, you know, find out, you know, make a space for themselves in the market. Empanelments, these bring patients to you, and without these, I've myself significantly realized, before I had any medical claim approvals, uh, and after, the overall number of surgical procedures have more than doubled, maybe even tripled. And now if I say out of all my number of surgeries, I think about 70-75% of all surgeries are empanelments or all medical procedures. The rest are Ayushman and other things. So this is a list of, I think everybody should do, whether you are you're running a corporate hospital or you're doing a private setup. Uh, Even if you don't have your own hospitals, if you're running private clinics and you have affiliations to diagnostic and neutral surgical centers, make affiliations with surgical centers who have these approvals so that you can take care of these empanelments. You don't have to have your own hospitals to take patients of all these institutions. So this is very, very, very important. This will immediately build up your practice. And the last thing is, when you're running a private practice, you can actually the patient knows who's in charge. The patient knows the person sitting inside that room can be approached with any sort of any basic issue, and that personal touch can be given in a private setup, which usually maybe lacks in few of the corporates. So that is where you can build your trust as a private practitioner and compete with the corporates. Yeah. And again, ethics are very important. It can be very, very easy to just diverge from this path, because we all have VMIs, we all have loans and everything, we all have equipment to take care of. But ethics is knowing a difference between what you have a right to do and what is right to do, and eventually it does show off in your practice. So that is extremely important. Thank you.
Very nicely covered, Kuchagra.
Thank you, sir.
Fantastic. At your age, you have done fantastic work.
So sorry for the again. I'd apologize to the next session team but we got the hall 40 minutes
40
late.
minutes late, yeah.
So we'll still try to wrap it up much before he's going to cut short his presentation. Over to you, Nilesh.
Yeah, thank you, sir. I'll just
So he's going to talk upon high fixed cost in a low profit setup.
So thank you, the AIO Scientific Committee, for providing YOSI and me this opportunity. Actually, my talk was on high fixed cost setup, but when I saw the list of speakers, there are two components of it. One is the instruments that we are buying and the EMIs that goes for it. So it is one part which Jignesh sir has covered, and other is the value-added services in a low-profit setup. So I work in a tier 3 city where we have a population of around 2 to 3 lakhs, and a area that we cover is 5 kilometers. The entire city is of 5 kilometers. But luckily, the neighboring districts don't have such good setup. So we have a drainage area of around 200 kilometers. And that's how we started building it up. There is a second generation practice. I joined my father 2 years before. So what is a value added service? What it is defined as something that is beyond your core service. Our core services are OPD and IPD services. So that is the core service that we have. Apart from that, there are the value-added services like the OPD appointment, how easy you can make it for your patients, how the ambience that you are giving to your patient, and much more than that. And then there are in-house and then outside the house, like if the patient can book their appointment on website through a call center. If you are calling them for follow-up, reminding them that they have to come, they have to put drops, something like that. That is overall value-added service. So which each of them comes with a cost, and we have to calculate the cost. So I'm not going to tell about all the initiatives that we have taken, but I have chosen 3 examples for this. So the services that you want to offer, there are plenty. When you go to any hospital, any big hospital, corporate hospital, as Kushagra was telling, you see there are so much to offer, and you think that you want to offer all those to your patients. But what amount of all those services the patient needs actually, and is that service improving your turnover? So when all these 3 points hit, that is the value-added service that is fit for you and fit for your practice. So let's discuss some bottlenecks. Say in appointment, we had my father, because he used to see only 20-30 patients per day, so he had a waiting time of 2 months, and patient had to come to our hospital, take an appointment, go back and remember that there is an appointment, because there was no reminder, no SMS. It was all written on a chit and given to them. If they lost the chit, their appointment is gone. Sometimes they used to forget that there is an appointment after 2 months, and there was a lot of hodgepodge that used to happen. Apart from that, I think everyone will be feeling billings, accounts keeping, health record keeping, everything has some bottleneck. So we have to identify the pain points. So in value-added service in OPD appointment, what I introduced first, even before coming, was a website appointment. A website I made on Wix costed me around 800 rupees and a Razorpay gateway. And I opened up a slot, 1 hour slot for my father. So it was all automated. And when the patient used to search on Google who is the best ophthalmologist, because we had a website, it used to come. And then on the website only, they can book appointment, pay. So we were sure that patient is coming. They were getting automatic reminders. And most of the patients whose son or daughter is in Pune, Bangalore, Chennai, they used to book appointments for them. Then when I joined, I started a call center, a dedicated 1800 number, which is costing me 70,000 rupees per month. But what it does is now most of my appointment, we have a drainage area of now 5 districts. From 3, we have improved to 5. Even from UP, we are getting patients because they can call up, get an appointment. They get a time. You have to come at 11:05. So they come at say 10:45, less waiting time. We also have free space, so we are catering to more walk-in patients right now. One day before the appointment, the call center calls them up, reminds them that you have appointment tomorrow. So if they want to reschedule some family emergency, they have to cancel. It becomes very easy for us, and they also follow up on the patient. If anything we want to do, we just tell them that you call up all the surgical patient in last month and ask how they are. So they do that. So that is worth it, and it has improved. Now coming to in VAS in OPD, I bought a machine that was costing me around 70 lakh rupees. It's Claris 700 wide field imaging. But when I saw the patient had to wait 4 hours in my OPD, and most of the time was them waiting because they had to come ARNCT optometrist, then wait time, then primary examination by consultant, then dilatation time of 1 hour, then cataract and fundus evaluation, then glaucoma visit, retina investigation, then again they had to wait for me with me to have another talk. 4 hours of waiting time. Any alternate thing, there is going to be 3 to 4 hours. And this I saw in SNAC also, Singapore also, there was a big banner saying you have to wait for 4 hours. If Singapore was not able to find a solution, was there a solution for it? So these are the wasted resources that were there. What I did is ARNCT, Claris imaging for free for everybody. So they get an ARNCT, just beside ARNCT, my fundus imaging is kept. Everybody gets it for free. But what it does is there is less turnaround, faster turnaround time, only 30 to 45 minutes, the in and out of patient for routine refraction and any other thing. Even diabetic retinopathy screening, because a 200-degree field of view is there. I can do diabetic retinopathy and send off the patient. So the patients that I dilate are only the cataract patients and high myopes, like more than 2.5 diopter, where there is a high chance of lattice and I need to see the entire periphery. I am getting more premium clients because their day is not lost. All the doctors, all the lawyers, all the judges, all the bank professionals, they come to us now. So our clientele has become more premium because of this. And because of the patient flow, our revenue turnover is like we are seeing more than 20 patients per day we are seeing, just because we have a Claris imaging. So it is paying like that. We are doing it for free, but actually it is paying me through the increased turnover. And now the last thing that I will put before I wound up is active calling and patient follow-up. So at 1 week, our call center calls up the patient, asks them how they are doing. They feel that the doctor is thinking for them, but it is actually not for them, it is for us. The patients used to come to us at 1 week, they had nothing. We just see them on slit lamp, everything is okay, they go back, but there is a 2-hour waiting time. Apart from then, that, they had to travel a long distance to cover that. A simple phone call, how are you doing? Have you started taking head bath? Are you washing your face? Please do that, otherwise you will get redness or you will get itching or something like that. That assures them that we are thinking for them. It is reduced number of follow-up visits for us, so we are seeing more fresh patients rather than seeing the same patient without any added benefit. And if they tell that there is some problem, the call center tells them, okay, you come tomorrow at this time. They come, overall patient experience is better. So these are the few value-added services that we have taken up, and I think that makes it premium in a low-profit setup. Thank you.
Real smart working, boss. Very nice.
Thank you, sir.
So that was a wonderful talk, and we will conclude the session now. The speakers are available for questions. We can take them outside the hall so that the other session can start. Thank you. And again, I would apologize, but we got the session 40 minutes late. Thank you.
Absolutely.